live from our Milwaukee studios with stories that matter to you. This is Fox 6 Wake Up News.
There I am, praying for this moment to pass. Drowning on the sheets I just changed. Nightshirt is rinsed, feeling depressed. You got that nice sweating. We know how you're feeling. Feels like forever, baby. You got that.
Well, isn't that fun? From the scene of Menopause the musical, there's humor in this midlife change facing older women, but dealing with menopause can be challenging and symptoms vary, help varies. We're here with gynecologist Dr. Francisco Garcini to kind of walk us through the process. Thanks for being here.
My pleasure.
OB/GYN for many, many years, and realizing that there's still so much misinformation and intimidation, trepidation about menopause.
Yes, the true thing is that there's no cookie cutter solution for the treatment of menopause. Every woman is an individual with her own symptoms and her own medical history and her own problems, and the provider that is taking care of really has to tailor the treatment to the individual.
And one of the scariest things, I think, is because no one can really tell you, like, you know, when it starts. So knowing the symptoms or some of the symptoms can be important. Hot flashes, but not everyone gets hot flashes.
Not everyone gets hot flashes. However, it's one of the most common symptoms. Up to 75% of women that go through menopause will experience hot flashes. Other symptoms include night sweats, insomnia, irritability, mood swings.
Just a whole host of things that could be any day, like when you're 20. I mean, you could have mood swings. But let's talk about, those are the symptoms. Let's talk about things, natural ways to help you deal. And soy, I've heard a lot about soy protein. What is that?
Soy protein is basically a powder that is extracted from soy. It is rich in a protein and also a type of substance called isoflavones, which is a plant estrogen-like compound. And this, the beauty of this is that it's completely natural.
And what does it help?
It helps mainly with the hot flashes.
With the hot flashes, and I've heard that. If you don't want to go on hormone replacement therapy, this is a natural alternative. Sheets, what does that have to do?
Well, you know, some women experience hot flashes with night sweats, and they'll wake up in the middle of the night drenched.
Yeah.
So one of the strategies to follow is actually to get 100% cotton sheets. They're absorbable, breathable, and that will alleviate some of these symptoms.
So you're not cooking yourself, and the same thing with the bedding, the comforter.
Absolutely. There's different varieties. They come in different prices. The best thing is to try different ones and find the one that's perfect for you.
Yeah, sheets. And then tell me about this, flaxseed.
Well, there is some evidence that flaxseed may be beneficial in treatment of hot flushes. But again, the menopause strategy is to try to live a healthy lifestyle that will alleviate some of these symptoms. And flaxseed is not only a good source of fiber, but it also rich in omega-3 oils, which of course can be beneficial.
And by healthy lifestyle, get active, no alcohol, no smoking.
Absolutely. Smoking and alcohol have been shown to increase the risk of some of these symptoms.
Okay.
In addition to that, coffee can increase the
Oh,
symptoms
don't say
as
that. I'm going to die without coffee. All right. And fish oil and what is
melatonin.
Melatonin.
Melatonin is a nutritional supplement that has been shown to help sleep at night, and insomnia is definitely one of the symptoms of menopause.
And then your adult life, we should say. There can be some symptoms with menopause. We talk about changes in our body, dryness being one of those issues. There are things that you can do for that too.
Absolutely.
And that's what no one wants to talk about, and it's kind of hard to talk about.
Yeah. You know, vaginal dryness is one of the common symptoms. There are many ways of treating them. Some are hormonal, some are non-hormonal.
But talk to your doctor.
Always talk to your doctor. Even with these natural supplements, there can be side effects and interactions with medications that the patients are currently on. So it's always a good idea to embark in any type of treatment plan, always talking to your doctor.
All right, Dr. Frank, thank you so much. No coffee? I'm going to be a raging lunatic. Not that it's happening anytime soon.
That's right.
I'm not planning it, but...
That's right, which means I need to retire soon.
I know, right? Oh, wait, what are you saying?
Clock is ticking on my safety in the studio is my point. I already have a mother-in-law. She's not about the coffee, but if you try to take that woman's 3 o'clock wine away from her, no, that is not going to work out well. Symptoms, schmimptoms. Let's take a look at what's going on.